Madam Deputy Speaker, as the final backbench speaker this evening, when we have no votes on a one-line whip, we could call this the graveyard shift, but I'm grateful for the opportunity of being called, and thank you very much indeed. Government policy in 2020 has been to strike a balance between conflicting priorities, and I want to publicly commend the government for what they've done. For any journalists that may be watching, we are damned if we do and damned if we don't. And having done a few tough jobs myself over the years, I do recognise resilience, pragmatism and unwavering dedication. So it's a big tick for the government, if I may. The macro imperative this year has been to keep people safe in line with public health advice. And that's entirely right. But I do want to say a few notes of warning, if I may. First of all, the government's support to the pandemic has been excellent. Notwithstanding 3 million excluded, about which I still am concerned, it's been pretty good. With over 1.5 million new claims to universal credit, 9.6 million jobs furloughed under the job retention scheme, claims totalling £41.4 billion. The massively generous coronavirus large business interruption loan scheme, 78,000 loans worth £18.4 billion. We've also had £300 billion or thereabouts from the Treasury to support the country at this difficult time. It's got to come back. And the important thing for me as individuals is that we need to learn to live alongside the virus and not hide from it. So we have got work to do to getting back to normal, putting the money back into the Treasury and also carrying on next year alongside the virus. Christmas is very welcome for all of us, and I welcome the government's rules in respect to Christmas. And the relaxation of rules over this festive period do show that the government understands how important this is to the mental health of the nation, and also how far we have come in a short period of time. Welcome steps have been taken. Launch of visitor testing, visits regardless of tier, indoor visits, care homes. The list goes on, and I'm grateful for what's been done. But these enhanced freedoms are effectively a gift, and the risk of a third wave or further lockdown in the new year cannot be the price we pay for losing our resolve and will over Christmas. Locally in Bracknell, I visited the Lexicon shopping centre this morning. It's a fantastic indictment of what can be achieved. £240 million regeneration project supporting the Christmas Wish campaign. So the Lexicon is doing its bit to do everything possible to attract shoppers into this fantastic setup. And I was struck by how vibrant and how busy it was today. Lots of people, a full car park, all supporting the high street. But the important thing is it was safe. People were wearing masks. Excellent measures were in place in shops. There was clear distancing down the aisles. And I'm really grateful to Bracknell Forest Council for everything that it's done to make sure that supporting our high street can be done safely. And given the very low rates in my constituency over the last few months, it would be easy to complain that Bracknell is being put into Tier 2 rather than Tier 1. But by the same token, we've got to be pragmatic, because next door in Slough and Reading, the rate is much higher. And of course, our own rate in Bracknell is rising too. So there is no time at all for complacency. And finally, a quick plug, if I may, for Brants Bridge, which is a medical facility in my constituency. I really welcome that the government is setting up a new Covid-19 Lighthouse laboratory at the walk-in urgent care centre at Brants Bridge, one of 2 in the country. This is expected to process 40,000 tests a day at full capacity, processing those from drive-in centres and home tests across the South East. This is part of Britain's largest ever network of diagnostic testing facilities. It will create 300 new jobs for local people, 170 in logistics, 100 scientists, and also 30 supervisors and managers. It should be open in January, running 24/7 and hoping to reach full capacity by February. It's a result of a collaboration between the Royal Berkshire Hospital, Frimley Health, Royal Surrey Hospital and the Ashford and St Peter's NHS Foundation Trusts. A fantastic indictment of what can be achieved. And thank you also to the East Berkshire Clinical Care Group. The vaccine really gives us hope, and it's being rolled out. In Finch Hampstead, in my constituency from tomorrow, with a capacity of over 500 per day, and more broadly in Bracknell, from next Monday. It's really exciting for Bracknell constituency and beyond, of course. And also, we're pretty well served in Bracknell with hospitals. We've got 3 hospitals on our doorstep: Wexham Park, Royal Berkshire and Frimley Park, all of which are serving my constituents in a brilliant way. And I thank you for everyone who's working in the NHS and all key workers. Finally, as I wrap up, I just want to thank the people of Bracknell, Crowthorne, Finch Hampstead, Sandhurst and Woking Without for your pragmatism, social responsibility, patience and community spirit. We don't say thank you enough in this place. Without being glib, I'm proud of what has been achieved locally and I'm grateful. Merry Christmas to you all. Thank you.
Number 20 is withdrawn, so we go to Shadow Minister Helen Hayes.
Thank you, Madam Deputy Speaker. I'm grateful to all honourable members who've spoken in the debate today. Taken together, the contributions have served as an important reminder